Seizure Monitoring Center is a place where we do testing that enables us to further capture and define patients' episodes that may or may not be seizures. And if they are seizures, it would help us tell us what kind of seizures they have, because there's many different kind, and that may help us choose the treatment options. A lot of patients who have been diagnosed with seizures actually don't have seizures. Up to 30% of the patients don't actually have seizures. They have what we call seizure mimickers. And this test will help us see which one is a mimicker and which one is a true seizure. When somebody comes to Seizure Monitoring Center, they are taken care of by a very friendly staff, and we attach electrodes to the patient's head, and it records the electrical activity of the brain, and we have somebody monitoring that 24/7. Hey, it's Dr. Singh, how are you? So we can correlate the event with the EEG recording and see what was going on in the brain when patient was having their clinical event. That knowledge plays an integral role in deciding which therapy may be best for the patient. The ideal candidate for Seizure Monitoring Center can be patients that are newly diagnosed with seizures, because it allows us to again capture their episodes and get them onto the right diagnosis from the get-go. Or it could also be the patients who have tried many different medications and things don't seem to be working, and now we need to take a second look.
It was a very positive experience. I really wasn't sure what to expect going into this. I'd heard stories from other people who had this monitoring process done where you were stuck in a bed, kind of rough, couldn't leave the room, and this was not that experience. I was just floored by the kindness and just how every day it was just a great conversation. It was genuine. It wasn't fake. It wasn't just, you know, they're doing this because they have to. It was genuine kindness.
Once the electrodes are attached to the patient's head, we have a trained personnel monitoring patient for any seizure activity. And if patient does have any clinical events, then we have our nursing staff as well as other members on site to take care of the patient and address their clinical needs and do whatever it takes to care for the patient.
For me, it was honestly, because I'm a father of 4, and I say this jokingly, but I'm also serious too, it was a break. I mean, and I felt like I was cared for, and I was getting some answers and things that I was questioning.